inflammation is referred to slow, long-term inflammation lasting for prolonged periods of several months to years. The response is mediated by chemical mediators and any or all of the following cell types: lymphocytes, plasma cells, histiocytes, benign giant cells, mast cells, and eosinophils. Lymphocytes, macrophage, and plasma cell are predominant in chronic inflammation. In the slide of chronic inflammation, we can find inflammatory cells, tissue necrosis, fibrous tissue, and new blood vessels.
Hi guys, today I am going to explain about the histology of chronic thyroiditis. Chronic thyroiditis is a long-term disease which microscopic examination reveals an extensive infiltration of the parenchymal cells by monocular inflammatory infiltrate containing small lymphocytes and plasma cells. In a dense lymphoplasmacytic infiltrate, a varying degrees of fibrosis can be seen clearly at the arrow on the picture below. It shows a complete replacement of normal cells. This inflammation is caused by T cells and plasma cells, which are thought to cause a direct damage. As a result of continuing inflammatory cell damage, thyroid epithelial cells commonly shows oncocytic, or also known as Hürthle cells, transformation. The Hürthle cells is having a strong eosinophilic granular cytoplasm and slightly enlarged nuclei. This is a metaplastic response of a normally low cuboidal follicular epithelium to ongoing injury. This arrow on the picture shows a large with abundant finely granular eosinophilic and enlarged nuclei. In fine needle aspiration biopsy samples, the presence of Hürthle cells in conjunction with heterogeneous population of leukocytes is a characteristic of Hashimoto thyroiditis. Thank you.
Myocardial infarction is defined as myocardial cell death due to prolonged ischemia that is greater than 8 weeks in duration. By the definition, myocarditis means inflammatory damage to the myocardium. In most of the tissue damage, infarction occurs in acute inflammation response followed by replacement of necrotic tissue by granulation tissue. Then, it will undergo fibrous tissue repair and scar formation. This is irregular fibrous bundle that replace the cardiac muscle as in chronic myocardial infarction. This is granulation tissue with a rich vascular network and early collagen deposition. This is scar tissue under 40 times magnification. As we can see, the infarctor fibers appear pale because it is more fibrous and leading to the formation of highly collagenous scar tissue. Macrophage and lymphocyte also appear in scar tissue. This is necrotic myocyte under 100 times magnification. Most of the fibers has lost its nucleus because the myocytes have been completely removed by phagocytic activity of macrophage and neutrophil. Then, it will be replaced by granulation tissue that consists of loose collagen. Tuberculosis.
Tuberculosis is an infectious disease usually caused by Mycobacterium tuberculosis bacteria. Tuberculosis generally affects the lungs but can also affect other parts of the body. Most infections do not have symptoms, in which case it is known as latent tuberculosis. About 10% of latent infections progress to active disease, which, if left untreated, kills about half of those infected. The classic symptoms of active TB are a chronic cough with blood-containing sputum, fever, night sweats, and weight loss. It was historically called consumption due to the weight loss. These are the tuberculosis histological view with 4 times, 10 times, 40 times, and 100 times of higher magnifications. At this 40 times of higher magnifications, we can see the central gaseous material is made up of necrotic inflammatory cellular debris which appears as amorphous structureless eosinophilic material. Under the microscope, we can find scattered Langhans-type giant cells as seen in this layer. External to the palisaded epithelial cell, there is a diffuse infiltrate of lymphocytes and some plasma cells within collagenous fibrous tissue.
Chronic gastritis is a very common disorder which is commonly caused by Helicobacter pylori. The presence of H. pylori is strongly associated with an acute and a chronic inflammatory infiltrate. It was seen that H. pylori, chronic inflammatory infiltrate, neutrophilic infiltration, presence of lymphoid follicles and aggregates and surface epithelial damage are strongly associated with each other. The chronic inflammatory response is an intermediary between the acute inflammatory process and glandular atrophy. The presence of one of these histological features is a strong indicator for presence of other features. In the presence of dense chronic inflammation and infiltration by neutrophils, the presence of H. pylori is closely related. So based on the chronic gastritis slide, there are an abundance of plasma cells and lymphocytes indicating the inflammation is chronic. Lymphocytes can be distinguished between plasma cells, where lymphocytes have scant basophilic cytoplasm, round nuclei, and no prominent nucleoli, and they are the effector cells of specific immune response, consisting of cytotoxic T cells and B cells, while plasma cells have eccentric nuclei with clock-phase nuclear chromatin, and an abundance of amphophilic cytoplasm that is responsible for antibody production. The second slide shows the infiltration of neutrophils, shows an active chronic gastritis consisting of both acute and chronic inflammation. Upon pathogen infection or irritant infliction, local macrophage and other cells sense the insult and produce a panel of inflammatory mediators such as cytokines and chemokines that stimulate the nearby microvasculature and attract large numbers of lymphocytes to migrate across the vascular wall and infiltrate into tissues. After arrival at the inflammatory site, lymphocytes perform phagocytosis and also release powerful antipathogen and tissue-damaging reagents to kill pathogens and aberrant cells.